A friend gave me feedback a while ago. Some people say you're arrogant, but I said no. He's just self-confident, I told them. He followed, we need that in a doctor, but you know, there's a fine line between those two characteristics, arrogant and self-confident. Ooh, that threw me for a bit. After thinking about it, I took it as an honest comment and an effort to allow me a way to improve myself. As a physician philosopher once said, a true friend will help you grow by pointing out your warts. Instead of getting angry, one should take it as an opportunity to get better. What is arrogance? The dictionary's definition is harsh, an offensive display of superiority or self-importance, overbearing pride. I see it in people who treat others poorly, especially those who are lower on some hierarchy. Examples would include an employer who expects sexual favors of some kind, or a prison guard who harasses a prisoner hatefully, or a teacher or parent who supervises a student or child unjustly, or, to make the point, a doctor who treats a nurse or another partner or a patient poorly. I believe nothing indicates the true color of an individual more than how she treats someone who may be lower on that totem pole. I've seen examples of physicians acting this way. When a surgeon threw a scalpel across the room, when a specialist spoke negatively to the patient about their primary care physician, or when a surgical resident treated an inner-city young woman infected by gonorrhea with disdain and contempt. I'm not proud that my profession probably deserves some reputation for being arrogant. On the other hand, part of the value provided by the physician comes when the patient senses that the doctor is competent and knowledgeable. A humble physician is one thing, but an unsure and uncertain doctor is another. Perhaps sometimes I've come off as a know-it-all. I need to work on that because I do not know it all. In fact, it seems the more I do know, the more I realize my inadequacies. My folks came from humble backgrounds and I grew up drilled on the golden rule. The last thing I want to do is to portray myself as a physician who thinks he's more important than someone else. Rather, I would like to be known as a competent physician who cares.